usage of it for 1 month now. I'm seeing a dramatic improvement on my very own skin and many people around me. And now also there's a question that just came up on my screen. And so, because we're doing live calls around the world, and perhaps it was already answered, but I want to repeat that one more time, because a lot of people, because of the product, I want to repeat the question, so maybe you can address it one more time, and this is important to some of the callers. And first, part of the question is, and I know you already answered it, but I think it's good to hear one more time, is that first, whose stem cells were used for this product, and who was the donor? That's part one. And part two is that, is there any risk of transmitting disease or genetic coding through the use of this product or technology? Can you tell it one more time clearly so that
Sure.
we can address it once and for all?
Most of the cells came from my patients' stem cells. When I was doing procedures, we were taking the fat out, and we used their stem cells. So we know that before we do this, we test them, and we make sure that they're not ill and they don't have any viruses that they can transfer. And then we took these cells to the laboratory. There they got processed, they got tested, they got screened for viruses, hepatitis, HIV, mycobacteria, and they're tested on a routine basis. Besides all that, they go through rigorous cleaning, and there's a whole process that goes through to get the product from these cells. So once we get the product, we make sure that there's no cells, there's no live cells within the product. It's all just the cytokines, growth factors, and all the good things that we want that the cells communicate with. That's what we take and put in the bottle. We don't put any of the stem cells, we don't put any of the genetic products, the DNA, or any other things that could possibly go into there. Everything in the bottle that we are using for the product are basically inert. They're not going to. They're not live. They're basically just the byproducts of the cells. So there's very, very strict guidelines that we've put in place to make sure that there is no cells and there is no risk for infection to anyone from this product.
Wow, wonderful.
In fact, this product is a lot safer than most other products that we put on our skin because none of those are tested, and here we're testing it. So over there, if they have a batch that is infected or they have a batch that is contaminated with bacteria and you're putting it on your skin, you're going to get a breakout, you're going to get infection. But here we're really stringent in testing and making sure there's nothing that we could pass to anybody.
Wonderful. Now, what effects does this product have on those skin types that are prone to develop keloids?
Very good question. At first, we thought we were going to use it for keloids once they've developed to treat it. We've used it for some, and some people have responded a little bit, and some people didn't respond, depending how big and thick and how old the keloid is. And a keloid is basically, for those who don't know, is just a scar that is overgrown, that is really thickened, and is not flat. But what we've noticed is that if we use it early enough, when you just get the cut, and you start to use it right after the skin starts to heal, not when it's open, but right when the skin just closes and starts to heal, and you start to use Luminesce, that's when you get a better healing result, and you get less of this scarring than you would without the Luminesce by itself.
Yep, we actually got a few testimonials on those people that have scars, and they actually saw an improvement. Now, also we actually get a lot of testimony. People talking about it actually helped with their acne and also and their stretch marks as well. And so can you comment briefly about that?
Sure. Like I said, because of the fact that the product contains these language that the cells use to communicate with one another, it works to decrease the inflammation. And when you get acne, you get inflammation. You get this red, painful zit. And when you put it on, or if you have rosacea, it's the same thing. You get this redness, the flushing. When you put it on, it goes in there and decreases that inflammation and starts to heal the tissues. So that's why it works on those things. For stretch marks, again, when it's fresh and it's just tearing, you go in there and it takes down the inflammation and starts to repair the cells so you don't get the stretch marks to become really thin and loose and wrinkled. And if it's a little bit more developed and is already the wrinkles are there and the stretch mark and it's thinned out, over time it can help to build up some of the collagen and some of the elastic tissue and to smooth out some of that scarring that's on there.
Wow. Now, speaking of that, stretch marks, is there any issue with pregnant women? Because, that's a very easy way to get stretch marks as you're carrying a big belly. Can pregnant women use the Luminesce on their belly?
I think, that should be addressed with their doctors to see how they feel because, when you're pregnant, it depends on how conservative you are. There's nothing in the product that would harm the baby, so they can use it if they want, but I would have them ask their doctor to make sure it's okay.
Wonderful, wonderful. Now, last technical question. Have before and after punch biopsies been done scientifically to demonstrating the efficacy of this product formulation?
I briefly touched upon that before. When we did our studies, we did it clinically, and we saw that we were seeing the changes so dramatically on the skin that we didn't feel that we needed to go and do a microscopic examination to see that it was making changes because you can see it right away. The reason we didn't do the punch biopsy studies is because it leaves a scar when you cut on the face, and nobody really wants a scar on the face. If somebody wants to volunteer and come and do a study, I'll be happy to do it. But there's a little scar that is going to come from doing it, so that's why we haven't done it.
Gotcha. Well, you know what? I know this is so helpful to a lot of people. I'm actually a very simple layman person, and the way I see it working is that you try it, you use it, and you see the difference. I mean, it's absolutely amazing. And now, so in closing, Dr. Newman, is it safe to say that this is the world's first adult stem cell technology serum out there?
This is the one only that I know of that has been truly made in the laboratory. I mean, I know people talk about all sorts of stem cells from plants and things, but they're not this product. This product is human adult stem cells, so it's not to be confused with anything else. There's nothing like it, and it's unique because it is from humans, so it can communicate with cells that are in our bodies to do what needs to be done to heal us and to make us healthier and more youthful.
That is so powerful, and Dr. Newman, thank you so very much, not only for your time, but more important than that, thank you for coming up with this incredible product. And one request that we like to make is that because it's so valuable, the information, we would like to have, all these Q&As, and maybe perhaps we can put a happy response in writing, and then we can put it on the website. Is that all right with you?
Yes, absolutely.
All right. Well, once again, Dr. Newman, thank you so much for your time, and this is so valuable and also very helpful, and thank you for bringing such a wonderful product to Jeunesse Global. Thank you.
Thank you. Bye.
All right. Thank you. Well, folks, you know what? There you have it. For those of you that have more questions, feel free to email the company. We'll be compiling a list of Q&As, and we will make that available on the website. And as we build, keep in mind, folks, we're about a month old, and we are already getting pictures of old stretch marks that are diminishing. We're collecting so many pictures of people's eye bags. It is absolutely amazing. We have a wonderful lady, a fierce leader that builds internationally. Her name is Winnie from Indonesia. She only puts on half of her face. And as little as 1 week, you can actually see her eye bag diminishing. And right now, it is so remarkably different on both sides of her face. So all of us are concerned. We tell her, listen, Winnie, you got to put on the other face, okay? You got to catch up. Let the other side of the face catch up. But I'm telling you, you know what, folks, not only do you have an opportunity to have a product that is so remarkable, that's so on a cutting edge. At the same time, you also have a financial opportunity to change your life. And so I hope that you get involved with us, start building this business, and we'll look forward to having more of these series of trainings so that we can get all more educated and you can gain more confidence as you go out and talk to people. So once again, this is Kim Hui coming to you live from Southern California, and we will have this call, the recorded call post on the website somewhere. So anyway, once again, I thank you all for your time, and I know that we have a lot of people so early in the morning and in other parts of the world plugging in, and thank you so much. And for those of you out in Indonesia, I look forward to seeing you next week. So once again, thank you very much. Together, let's make a difference on people's faces, on their body, and be healthy. Thank you, everybody. Good night, good morning, good evening. Thank you very much. Have a good day.